Hey everyone, good morning. This is Nick Slamon. I'm an intensivist at the DuPont Hospital for Children in Wilmington, Delaware. And in today's tutorial, we're going to go over some of the setup involved in central venous catheter insertion. Now we'll set up a different video, a different tutorial for the actual insertion of the catheter. But today I want to go over some of the steps for preparation, what's in the kit, what all these things do. I think that's important to know before you kind of dive right into let's get a needle in the neck and let's put a central catheter in. So here we have a table set up that's in various stages of kind of preparation. And then over here, we have a full table that'll go over each piece of the equipment that's found in this kit. So why don't we start here? So after good hand hygiene and washing my hands, I'm going to get myself a pair of gloves. These are latex. If you're allergic, you can get a non-latex version. They come in sizes that are full sizes and half sizes. I happen to wear 7.5, but it's usually stamped on the glove what size you use, and you can just measure out your hands. These are all sterile, so they're completely sealed. And when you open this packet, and you usually just rip it from the top, inside is a folded piece of sterile paper, and you kind of gently unfold it to expose the gloves inside. Now, let me just give you a quick look at this. So I'll often lay these gloves down on the surface. And again, I've already washed my hands, but my hands aren't sterile. So how am I going to get sterile gloves on without contaminating the gloves? Well, as you can see, they're kind of folded in half. And what is here is the piece that I can touch, which is the inside of the right glove. And it's going to be up against my unsterile skin, so it doesn't matter. So what I'll often do is get my right hand kind of partially shoved in that glove, and using my left hand, I'm going to peel that inner surface down onto my wrist. So now I have one right hand that's sterile. Now that this glove is sterile, I can pick up the other glove however I want and kind of pull it onto my left hand, and now I have sterile gloves on. We're not going to do that right in the beginning because we have some other things to do. We want to put on our mask, our hat, our face shield, our sterile gown, so I'll go over all that. But I did want to take a second to kind of walk through what's with these sterile gloves and how do you get them on properly. A couple other things that may or may not be in your kit is a biopatch. So this is just an antibiotic impregnated piece of foam that will go around the catheter at the site of insertion, whether that be the jugular here in the neck or the subclavian along the collarbone or in the leg in the femoral. So that's also sterile, and it's usually not in the kit. So I'll have the nurses kind of peel that open or an assistant peel that open and drop it onto the kit sterilely. I have a chlorhexidine swab that is often not in the kit. So they come in different sizes, but I'll have the nurse or the assistant peel that open and kind of drop it from above onto my sterile worktop. And now that I mention it, what is all this drop it on the sterile worktop stuff about? Well, the kit comes like this. Fully sealed and sterile. Everything's inside the plastic container. Comes with a little bit of a ridge or an edge here, and you can kind of grab that with your fingers and peel that open. And on the kit, it's going to tell you the size of the catheter, how many lumens it has, how long is it. So this one happens to be a 7 French triple lumen 20 centimeter. It'll even tell you what size wire goes into it, and it's got a CDC number stamped on it so you can track it and restock it. But this is a multi-lumen central venous catheter kit. So I'm going to peel that top off. I'm going to take out what's inside, and what's inside is shown here. So it's going to be this plastic tray with everything arranged in it, folded up in this blue towel. And the blue towel is going to be completely covering the surface. And again, I haven't put my gloves on yet. My hands are clean, but not sterile. But I can take the edges of that blue towel and unfold them from the bottom, because the spots that I touch are no longer sterile, but it doesn't matter because that blue towel is going to be on the unsterile table that's been sitting in this room. So really what's important is what's in the kit itself when you unwrap it. That is sterile, and I can't touch any of that until I'm fully gowned, mask, hat, and gloves. And then I can start taking everything out of my kit and spreading it out over here on my table, which I have. So let's take a walk over to the table and talk about some of the contents. So all the contents of the kit are spread out here. And then again, I mentioned there's some things that aren't in the kit that you're going to need. Now, most hospitals like mine at DuPont have their own sterile pack that's separate You can kind of rip it open the same way. It's wrapped in a big blue towel like this that's sterile, and you can unfold the edges, and inside is usually going to be a hat, a face shield, maybe 2 of each, 2 gowns, usually some sterile towels, and a sterile drape. I'll talk about the sterile drape for a second. So often it has some clear plastic in the area of interest and a hole in the center. So that's usually, again, going to be a line insertion at the neck, the collarbone, or at the leg for the femoral. So the hole, the cutout, is where you're going to be working. And then around that is usually some clear plastic so you can kind of look down and see your patient. But as you can see, it's stamped. So it says head with some arrows at the top. And that's because the top part going to the head of the patient is short. And the bottom part is super long, so it covers the entire bed, torso, legs, and the distal part of the bed of the patient. So you want this to be completely sterile like an operating room. So it's important when you stick this down on your patient, you got some arrows saying, all right, well, now I'm going to unfold it. So you'll unfold right and left. I'm going to pull the head part to the head. I'm going to stretch the leg part out to the legs. You don't want to put it on upside down. So it's important to really kind of notice where does it say head. So all this stuff is going to come in your sterile pack. I do want to talk for 1 second about the gown. So the gown comes folded very neatly, looks like a notebook. What's important is that there's pockets right here on either side for you to put your hands in. You open the gown and then snap it out, and it just falls all the way down, covers your legs. You kind of shimmy your shoulders and arms into the gown. And then I usually have an assistant Velcro the top around my neck at the back so that now I'm completely covered. So I have a hat on, I have my mask on, I have my sterile gown on, and then I can go over and put on my sterile gloves. And after my sterile gloves are on, I can start taking the different pieces out of the kit and putting them on my sterile worktop where I can work with them. So contents of the kit, again, as I mentioned earlier, you may have chlorhexidine in the kit, may not. So if the nurse can get you one, great. If the kit has it, great. But you squeeze these wings and the chlorhexidine will be released inside the shaft. It'll drift down to this foam. It's usually orange, and you can then begin coloring the patient and kind of scrubbing their skin down with chlorhexidine. It leaves that orange color on there so you know what area you've sterilized, and you can then move towards draping the patient. The kit usually will have some gauze, but often not enough. So I often ask for a tub of 4x4s to be dumped onto my sterile table. You'll definitely need that when you get some bleeding after you do the dilation step. You usually have a tegaderm and that bio patch that we talked about earlier. So the bio patch will go right around the tip of the catheter after it's inserted and it's sticking out of the neck or the leg or the collarbone. Put the bio patch around that and then put a tegaderm above the whole thing. From a safety standpoint, you'll have these foam reservoirs for all your sharps. So when you're done with your needle, your scalpel, and so on, they can go right into there. And then you can take them over to your sharps container and put them in your sharps container. You'll usually have 3 or 4 saline-filled syringes. If you don't, an assistant can squirt saline, sterile water into your kit for you. And what this is going to be for is a couple things. So early on, we want to take our central venous line and we want to hook this up to the blue ports. We want to flush that line until water comes out the tip. We want to make sure there's no air in the line. We don't want to give anybody an air embolus. Now, it is important that the center lumen is going to be where your wire comes out. And we'll talk about that in a second. So I often don't cap the center lumen, but I do flush all 3 lumens, and then I'll sit my line down ready for use later. I have some suture here. This gets torn right along this dotted line. It'll expose the needle. And then I'll usually get my needle driver and I'll load that suture so that when I'm done this procedure, I'm ready to stitch. So let's talk about that for a second. So the catheter, as I said, if you look on the kit, it'll tell you the French. In pediatrics, we usually use 5 French, sometimes 4. Floors come as 2 lumens, 5 and above are triple lumen. This happens to be a 7 French triple lumen 20 centimeter line. There's markings along the catheter in terms of centimeters, and it's also on the kit so you know what you're using. You often will measure from the site of insertion, if it's the jugular, from the site where your needle will go in down to where you think the heart is. That'll give you a rough estimate of how long of a line you should pick. In pediatrics, again, we're using 5 Frenches, triple lumens, and we're somewhere in the 8 to 12 to 15 centimeter range, depending on the size of the patient. Adult sized patient, we could use a 7 French like this one, 20 centimeter, 25 centimeter, triple lumen. So a couple other things to point out. These caps are backflow pressurized, so once they're on, blood won't come backwards and clog up your line. Great to know. They also have some securing features. So there's these 2 holes on either side. So those are the wings. You stitch through the wings to hold it to the skin. And then there's a little notch here right at the tip of the line. And that's also for a 3rd stitch so that the line doesn't kind of knuckle out of the skin. So from a procedural standpoint, again, we'll make another video, a tutorial about the actual steps, but let's just go through it briefly. We're going to insert a needle into the jugular vein. For example, under ultrasound guidance, we're going to get venous flow. We're going to pinch the tip and twist off our syringe. We're just going to have a needle that's bleeding back a little bit. What we'll do next is take our wire, our guide wire, which is right here. You can see it's got a safety feature of a J-tip on there and a thumb guide. So if we pull the wire back into its holster, we'll straighten out that wire. We'll put it into the needle, and then we'll use our thumb to advance the wire while we have an assistant looking at the monitor to see if there's any ectopy. We don't want to cause a rhythm disturbance by putting a wire in a very sick, irritated heart. So they may say there's some VTAC, back off, and we'll pull our wire back a little bit. Now in pediatrics, I'll often take the wire out since it's so thin and small. I'll take it out of its holster, and I'll just use my finger, my index finger and thumb to advance it. And I really want that wire to go into the vessel like a hot knife through butter is the expression we use. We want the wire to just go smoothly. We don't want to feel like it's getting snagged or caught on anything. So needle in the vessel, wire in the needle. We'll take the needle away, and now we just have a wire hanging out of the patient. Next, we'll take our dilator and our scalpel. With our scalpel blade up, we're going to make a skin nick about 5 millimeters down into the skin. We're not trying to cut the vessel. We just want to make a skin track that this line will be able to flow easily through. We'll then take the dilator and put it on the wire. And with a kind of corkscrew motion, we'll advance the dilator all the way down to the hub into the skin to create that track. We're going to take that out. The wire's still in place. We're going to get some bleeding. So we're going to have our gauze ready to sop up some of that bleeding. And last, we're going to take the wire, put it in the tip of this catheter. We're going to pull the wire back until it comes out that center hub. We're going to secure it with our other hand, and then we're going to advance the whole catheter into the patient. Last step is we'll take the wire out, and we'll get our suture and suture that line in place. And then finally, we can put our biopatch down, put our tegaderm on top of that, and we're all set. Our procedure is complete. So again, we'll do another tutorial that really shows you the patient setup and how to turn their head and what should you do with the wire and what should you do with the needle, what should you do first. But today's lesson was really to go through what are all these things in the kit and how do I even get the kit open and get myself ready to do this procedure. So thanks for joining us, and I'll see you again next time.